Sir, you can carry on, sir. Sorry.
Thank you, Chintan. Thank you. Welcome to this 76th edition. We'll be completing the pending part of our previous presentation, practical illustration of how to manage behavioral issues in adolescents. Next slide, please. So let me hand over the stage to Professor Dr. Tufan Pati sir from Cuttack. He is our chairperson of the program. Sir, over to you.
Thank you, Alim. Good evening, everybody, and wish that all stay safe and sound all the while, in spite of the corona scare. And Mr. Chintan, will you unmute everyone and then the speakers can mute them?
Okay, sir, I'll do that. Give me a few minutes.
That will reduce the chaos.
Sir, now you can unmute yourself and please, you can continue, sir.
Yes.
Yeah, also disable the waiting room, please.
Yes. Thank you. I have taken 10 seconds for this procedure. I'm sorry for delaying the lecture that we are waiting from Dr. Sukta Abhiram. And I have with us our two vibrant moderators, Dr. Amrit Patjoshi and Dr. Alim Siddiqui, who are well known on this screen, not only on this screen, all over India. Welcome, Alim and Amrit. And now I shall introduce our chairpersons, Dr. Sabita Malhotra, who is the ex-dean and professor and HOD of psychiatry in PGI MER Chandigarh, and currently senior consultant at the Fortis Hospital, Mohali, Punjab. Her major achievements include clinical teaching and research experience for 45 years, 5 years set of 50 years. Special interest areas have been child psychiatry, acute transient psychosis, telepsychiatry, tobacco cessation, and psychotherapy. She has been honored in many ways by the International Association of Child and Adolescent Psychiatry and Allied Professions, American Academy of Child and Adolescent Psychiatry for outstanding contribution and global leadership in the field of child psychiatry. She has been the past president of Asian Society for Child and Adolescent Psychiatry and Allied Professions, past president of IASP, life president of IACAMH. Awards, she has about 30 academic awards, including DL and Murtira Oration, NND Oration, PPA Oration, and Dr. K. Week Oration by NAMS, Bagadia Oration, Tilak Venkobara Oration by ICMR, and others. She has authored and edited 9 books, published 70 book chapters, and over 250 research papers. With this, I present before you the great Dr. Sabita Malhotra. Welcome, Dr. Sabita. Next, please. And we have with us Dr. Nidhi Chauhan, a young, dynamic, promising psychiatrist from Chandigarh. She is also in PJMR, assistant professor, and she is MD in psychiatry, plus she has done DM in child and adolescent psychiatry, and befitting for this seminar, and we look forward to her inputs. Her area of interest, neurodevelopmental disorders, developmental psychopathology, early intervention, childhood schizophrenia, and psychotherapy. Publications in international national journals. She has co-authored book chapters related to child and adolescent psychiatry. Welcome, Dr. Nidhi. Welcome, Dr. Sabita Malhotra. Henceforward, this session is yours. Please take over.
Thank you, sir.
Thank you. Thank you very much. Thank you, Dr. Tufan Pati. And Nidhi, welcome, my co-chair. Good to have you here on the stage. Dr. Tufan Pati, many thanks for that very gracious introduction. And it's my pleasure and privilege to be here chairing this session on this Thursday Musings, the program. And congratulations to the team, Dr. Tufan Pati, Dr. Amrit Patjoshi, and Alim Siddiqui for completing 75. This is the 76th edition today. It's a great achievement and really speaks volumes about the consistent, persistent, and very painstaking efforts that go behind this. And today we have with us our speaker, Dr. Sukhada Abhiram. I will give a brief introduction about Dr. Sukhada Abhiram. Maybe I presume that she presented. I didn't attend the last presentation, since this is the second lecture of the series. So that means I presume that there must have been the first one that was done by her. And she is the first consultant psychiatrist in the country to start satellite office of Albert Ellis Institute affiliated training center in India. Wow, wonderful. She's developed interest in practicing CBT and REBT while in her active psychiatric practice under the guidance of her mentor, Dr. Anand Nadkarni, who has been teaching and propagating. REBT is rational emotive behavior therapy in the Indian context for more than 3 decades. Okay, after completing her advanced certificate practicum from Albert Ellis Institute, New York, Dr. Sukhada now functions as head of Beautiful Mind, the satellite office of Albert Ellis Institute, based at the Institute for Psychological Health in Pune. Dr. Sukhada has gained valuable insights in the application of CBT and REBT at different stages of mental health, namely disorder, distress, and development. So this spans the entire spectrum from normalcy to pathology, which are reflected in her modules and training programs. And these are like ABCD of REBT, Mast Mazeche Ai Baba. Okay. Inner Horizons, Password, Anandacha, Password to Happiness, Asmi, and many more. She is also into corporate training and using the principles of REBT regularly while working with clients like Reliance, Siemens, Cipla, Bharat Petroleum, etc., to name a few. Wow, what an impressive resume. Welcome, Dr. Sukhada Abhiram. We have great pleasure to have you with us to talk about some practical illustrations and practical aspects of handling behavioral problems in adolescence. Now, adolescence, we all know, is a very, very crucial phase in the development in the life cycle of individuals. And behavior problems are almost universal and common. It's starting from normal developmental issues to pathology of serious kind to mental illness, the onset, the heralding of mental illness, all that happens in this phase of life. And the vulnerability that is seen in adolescence phase is all of us, we all know about it. And we also know that all this arises from the state of development of the brain at this stage, which is very, very rapid and very, very, it's a exuberant growth and development that takes place and maturation that takes place at this age. That is what contributes to vulnerability at this age. And behavioral issues or behavioral problems that arise, they are kind of in several domains that we see, starting from cognitive, emotional, social, personal, and of course, everything manifests in the behavior. So all these domains get affected, and there are very, very unique issues, problems that are seen during adolescent phase that are reflected and and are seen almost, I would say, universally. All adolescents go through a certain kind of a phase of life where they have very difficult kind of a situation and problems that are seen in all domains, in cognitive, emotional, social, personal, moral, and until the brain develops to a kind of a more mature and stabilized state by the age 25. Till then, this is a kind of a state of flux and state of vulnerability and state of development. And so therefore also very important for us, that is when all the cognitive functions expand very rapidly and they stabilize, and the person matures into a career, settles down in life and completes education. So all these are the important functions attributed to this phase, adolescence. So I'm sure most of it has been covered in the last lecture with regard to what are the manifestations and nature of problems. Today's topic is to do with the management, and management, particularly practical illustrations. Before I call upon Dr. Sukhda, may I call upon Dr. Nidhi Chauhan to say a few words, and then you can call upon Sukhda to take the stage.
Thank you, ma'am. Good evening, all of you. And I would like to thank the organizers and Dr. Savita Malhotra for giving me this opportunity. And before I say anything about the topic, a very happy Lodi to all of you. Getting along with the topic, as ma'am has said, adolescence is a very important developmental phase in any individual's life, and the adolescence is going through a lot of physiological, psychological, physical, emotional, hormonal, and cognitive changes. For some, this phase is a very smooth ride and they just tide away just like that. For some, it is a very tumultuous phase, and having conflict with their parents for petty issues, peer pressure, their body image issues, having the onset of many psychiatric disorders, as Savita ma'am has just alluded to, is during adolescence, and thus embarking upon the role of mental health professionals in dealing with issues in adolescence. While we're talking of just psychiatric disorders and mental health issues in adolescence, I would say it is well a part of a normal developmental phase also. And thus, it's not just the role of mental health professionals, it's the role of all other adult significant others in an individual's and in an adolescent's life, which is very important, and how other significant adults in the life of an individual can actually modify and change the path of the developmental phase of the adolescent, and how we all together can actually help the adolescents navigate through this tumultuous phase in their lives. And I'm sure, having the kind of CV Dr. Sukhada has, we are going to have a very good experience and a learning session today, wherein she's going to give practical illustrations of the behavioral issues of the management of in the life of an adolescent. And now I call upon Dr. Sukhada to please present her lecture.
Thank you so much, Nidhi ma'am. Thank you, Savita ma'am, for the kind introduction. Very good evening to Tufan Pati sir, Amrit sir, Alim sir, and all my seniors and friends in the mental health field. As all of you know, last time we had seen the practical illustration of how to begin the session with adolescents. For those who haven't attended the session last time, me and the organizers had specifically discussed that let's not keep it to theory, because theory experts might have already covered these issues with adolescents. We had focused primarily on how to talk when a session starts, right from when the adolescent enters the room. What should be my language, my body language? How does the adolescent actually understand that this mental health professional is non-judgmental, is accepting towards me? And these are the issues we talked about while dealing with an adolescent, especially when the adolescents are being brought to us by the parents in the name of correcting them. So we discussed a few points and then had a case demonstration. After that, however, there were many questions regarding how to deal with parents, because parents are, at times they become much more difficult than the adolescents themselves, because they want an easy, quick and automatic answer to all of the issues of their children. And therefore we thought that today we'll address this issue of dealing with the parent of an adolescent, so that many things can come up during the issue, during the session, during the communication, and later on, if time permits, we can again have a session with an adolescent, of course, in terms of role play and interactions. So before we start today, and before we start with how a typical parenting session goes or stuff, I usually give this metaphor to parents, which helps them understand their children better. Right now, what Savita ma'am and Nidhi ma'am just said, that the cognitive and developmental stage we know is at the crossroads. There is cognitive, cognitive changes are occurring very rapidly. The emotional changes are occurring very rapidly. And all this is happening on a base of hormonal turmoil. So of course, this phase is not easy for adolescents. However, in addition to this, what parents are worried about is कि हमारा बच्चा ना डम्ब नहीं है. He is very smart. He is very intelligent. If he is so intelligent and so smart, why doesn't he or she understand maturity kahan gayi? And it takes a lot of effort from our side to explain to parents smartness is one thing and maturity is a completely different things. And we need to explain it to parents that although the kids of today are super smart, super intelligent, some areas of the brain which help in judgment, maturity, wisdom, conscience, etc., they are still the last to develop. Something like impulse control, it is the last to develop cognitively. But parents do find it difficult to understand because they have been aware of the child's smartness since probably the child was 2, that he operated smartphone better than us right when he was 5 years old. So the metaphor that or example that I oftenly use with parents before starting any session or practical session with parents is with this small principle that our cognition, the development of our cognition, it is directly proportional to the amount of stimulus received. So cognitive development is directly proportional to the amount of stimulus received. Now, what do we mean by that? Let's take a common example here, and I would be happy if all of you are participative here. Just to demonstrate this principle, let's say we can take, I'm not asking for volunteers right now, I'm just finishing with this metaphor. So what I wanted to tell you, if we have to compare the development, cognitive development of us and our children, let us say as parents, I ask you, and we take one stimulus, for example, cars. So when you were kids, when you were 6 or 7 years of age, how many cars did you observe on the road? Yes, anybody? Okay, Shailaja ma'am is saying 1, Sudeep sir is saying hardly any, not much, very few. Okay, so let's say your age on an average is 40, 50, whatever. The amount of stimulus in terms of one category, that is cars, let's say if we name it as X, please note it was quite few. आप लोग जो 40 प्लस होंगे वो तो बता भी देंगे कि मारुति थी, अपना फिएट थी, एम्बेसडर थी, and a couple of things more. Now, as compared to what you saw, the amounts of cars, the frequency of cars, and the models of cars. So the variety, the frequency, and the range of exposure. अगर इसे हम X कहते हैं, so if we compare it to what today's child experiences in terms of stimulus, वो कितना होगा? So आज कंपनीज ही 50 है और हर एक कंपनी के ऑन एन एवरेज अगर हम 5 मॉडल्स लेके चले, तो अब सोचिए कि वो बच्चे का स्टिमुलस, रेंज, वैरायटी एंड एक्सपोजर तीनों के इसमें कितना होगा. So if my stimulus was X, my child's stimulation is minimally 100x. Okay? और इसलिए ना हमें practically दिखता है that if me and my son are driving and a car overtakes us in speed, how will my brain process it? मेरा दिमाग इतना ही बोलेगा क्या रैश ड्राइविंग कर रहा है, कितने फास्ट जा रहा है. If I think about the model of the car, ज्यादा से ज्यादा शायद मैं उसका कंपनी कौन सा है वो गेस कर लूंगी, आइडेंटिफाई करूंगी कि या ऑडी है या BMW गई, क्योंकि वो बहुत स्पीड में गई. But the 5-year-old sitting right beside me, in a fraction of a second will say Q3 थी, and I look at him like this कि how could you? कैसे पता चला? So it's not something magic. It's not any rocket science. It's the simple principle. जितना stimulation, उतना processing speed fast. More the stimulus, faster is the processing speed. मुझे x स्टिमुलस था, मेरा x स्पीड है, आज 100x का स्टिमुलेशन है, राइट फ्रॉम देयर बर्थ उनका 100x जा रहा है. Some decades back, when mothers used to deliver their child, उनको एक रूम में रखा जाता था, लाइट कम, बहुत टेम्परेचर वेरिएशंस नहीं, कान कवर करो, ब्ला ब्ला ब्ला. आज क्या है? आज जब भी बच्चा बर्थ लेता है, the first thing that the kid is exposed to is मोबाइल्स, क्योंकि उसके फोटो लिए जाते हैं, क्लिक क्लिक क्लिक, और वो बच्चा देखता है. एंड वी वंडर कि अभी से ये गेज कैसे दे रहा है. माइलस्टोन्स हैव चेंज्ड. सारी पीडियाट्रिक के टेक्स्ट बुक्स हम देख ले, अगर इफ वी कंपेयर द माइलस्टोन्स टू इन टेक्स्ट बुक 30 years बैक, दे हैव चेंज्ड. प्लीज नोट, ये हमने जो एग्जांपल देखा ये सिर्फ कार्स का था. अभी कुछ भी ले लो, विजुअल स्टिमुलाई में टीवी पे चैनल्स कितने होते थे, प्रोग्राम्स कितने होते थे. आज चैनल्स कितने हैं, उस पे चॉइसेस कितने हैं. हम लोग जब खाना खाने बाहर जाते थे पेरेंट्स के साथ, तो क्या ऑर्डर करते थे, कितना वॉइस था, कितना चॉइस था. आज घर में बच्चा डिसाइड करता है कि मैक्सिकन खाना है या इटालियन खाना है. सो राइट फ्रॉम विजन, स्मेल, ऑडिटरी स्टिमुलस, टेस्ट, टच, हर एक में स्टिमुलाई हैव इंक्रीज्ड ट्रिमेंडसली, और उन्हें ये स्टिमुलेशन मिल रहा है राइट फ्रॉम द मोमेंट दे आर बॉर्न. नाउ मेरी कैपेसिटी x है, मेरा प्रोसेसिंग स्पीड x है, उनका प्रोसेसिंग स्पीड 100x है, एंड देयरफॉर दे अपीयर टू बी स्मार्टर देन मी, फास्टर देन मी. डे टू डे में हमें इसके बहुत एग्जांपल्स मिलते हैं ना, कि 4-5 साल का बच्चा क्या क्या कर लेता है, हाउ फास्ट देयर ब्रेन वर्क्स. बट अगेन दिस इज द पॉइंट एग्जैक्टली व्हिच वी टॉक विद पेरेंट्स, दैट 100x just means the speed of 100x, the smartness of 100x, but not the maturity of 100x. So speed है लेकिन judgment नहीं है, and unless until parents understand this, वो confusion इन दोनों चीजों में करते रहेंगे, and they'll expect their adolescents to act wisely, not just smartly. So this again comes to me because they don't have this exposure, or they don't have the scientific background which tells them that processing speed is directly proportional to stimuli. Point number 1. अब अगर ये कॉन्सेप्ट क्लियर है कि उनका ना ब्रेन का मॉडल ही अलग है, हमारा अलग वेवलेंथ पे चल रहा है, उनका अलग वेवलेंथ पे चल रहा है, तो लेट्स से इफ वी कंपेयर आवर ब्रेन्स टू अ कंप्यूटर, अगर इनका ब्रेन हम कहेंगे विंडोज का 10x है, हमारा ब्रेन कौन सा मॉडल है अभी? ये अगर विंडोज 10 है बच्चे आज के, तो व्हाट आर वी?
अलीम 11 है.
Okay, and some older people will say that we are still typewriters. So what is important is what will happen if a typewriter gives instructions to Windows 10. What will happen? Will the Windows 10 be able to grasp the instructions? It probably won't. And however hard this typewriter tries, or na, I keep on banging the buttons of my typewriter, it won't reach. Yes, sir. Alim, sir?
Yeah, there is a request that continue only in English, because some people are non-Hindi speaking. Everyone from India is there.
Sure, sir. Sure.
Yeah.
Okay. So my point is, no matter how hard the typewriter tries, Windows 10 won't understand its language because its wiring is different. So again, this becomes the second important point that we need to communicate with the parents, that we need to change our language of communication. Not in terms of language per se, but the principles of language which we are using with them. So when I was small, probably I was okay taking the authority of my mother and father. I never challenged them. Rather, the first time when I asked my parents, why should I listen to you? I remember it was not before 22. Till then, I respected authority. And of course, there are multiple reasons to it. Some being that I respected them because they knew more than me, because this Google parent was not available for me at that time. Secondly, I was dependent on them for many of my things. Today, that's not the case. Today, children know that even though my parents don't give me anything, I have many sources. At least this is what they perceive, because they have always been living in a world of plenty. So our childhood probably went in a zone wherein we knew that how hard our parents are working. We saw them calculating money, which today's children don't. So this is one thing. We feared them because we knew that they know more than us, which today children don't, because they think that they know more than us or better than us. So second principle while communicating is the language part of it. Authoritarian language generally doesn't help. So we need to be authoritative. We also need to be open for the language of negotiations. Parents often ask me, how come this is valid? We are elder, they should listen to us. So again, we need to tell them that things are not ideal anymore. Although I agree to you on terms of your wish, that because you are more mature and wiser in terms of experience, they need to listen to you, but just because we wish, it's not a rule. They will not. And so I should be able to look at my child sitting at the same level with me and talk it out, rather than the principle of one-upmanship, which says, I will talk and you need to listen. That is the second part. And the third and last part, which I generally tell parents, is that when parents argue that why should we make all the changes? They are smaller, they are young, they are adolescents. We are more mature, we have experiential wisdom. We have seen the world, we have seen 40 summers. Agreed that you are age-wise, you are elder, you are more mature, you are experienced. But the problem is, when we talk of evolution, does evolution ever go backwards? Just like a river. Has anyone seen a river flow backwards? So if we expect that the generation who is next to us learns our language and gets back to us, it will be extremely difficult for them. And that's why when we give examples now, that when we were small, this was not the case, they are not able to quickly relate to it, because they are already born in an era where they have seen the advanced world. So the third thing is, evolution is not going to flow backwards. And so it is better for me to learn the language of my kid rather than expecting my kid to learn my language going back and then communicate with me. So once I explain the developmental gradient of the kid, what is happening with this X and 10X, then the parents are at least better able to understand as to what is happening in these kids' brain and then start a better communication. Before we go ahead, any questions on this part of X and 10X? Or else we can start with the demo session now. Amrit sir, Tofan sir, is it okay if we take questions right now for a couple of minutes?
Yes, it's okay. Right. Yes.
Yeah. Yashashvi? I guess, are the participants allowed to unmute themselves? Yeah.
Hello, ma'am. So, ma'am, my question was, the explanations of explaining the parents can be done when the parents are educated, when they understand about evolution and all. What about parents who are not educated? How do we explain the same thing to them? Could you explain that maybe?
Sure. So if this X and 100X formula doesn't work with them because they don't understand the processing speed fadda, you can just explain it to them in terms of simple examples. For example, when you were small, how many options did you have while watching TV? Most of them will say we had Doordarshan, and later on we started with a couple of channels. So with less number of options, you are able to choose better. Just for example, you go to a shop and you have 3 pairs of shoes to select from. You would find it easier to select a pair of shoes for yourself. But let's say we keep ourselves in the place of today's children. And now, is there any difference where you were choosing from amongst 3 pairs of shoes and your child who has 300 or probably 3,000 pairs to choose from? So one part is there is a problem of plenty. There is availability of lot many things than we had. And so things were easier for us. Studying was easier for us because distractions were few. Let's say if we had these many distractions when we were in 10th, we had Facebook, Twitter, Insta, everything. We had YouTube and internet and everything. We had a mobile constantly in our hands. Wouldn't you get distracted? So while with use of examples in our day-to-day life, parents will be able to relate to it better that yes, I can't constantly keep comparing my child the way I was or with the way an ideal person should be in that age, because that era was different and this era is different. With n number of stimulus to them, with presence of n number of stimuli to them, their brain will tend to run amongst those stimuli more than my brain ever ran. Is this clear? Yashashvi, is this clear?
I think so. We can go ahead.
Let's move ahead. Any other question, or we can then.
There is a question in the chat box. If parents are from a typewriter age, then how they can try to go with?
Right. Again, the language.
I hope the children are not listening to this cast.
Yes. So even though the parents are from the typewriter age, see, the parents have intelligence and wisdom that they can grasp the language of Windows 10. What is it? One example that I gave you was negotiations. That instead of just ordering, we involve them in talking. We ask their opinions. Now you would say if we ask them their opinions, they would just jump onto or demand that we listen to all of their opinions. There is a difference. Let us say it's about giving my child alternatives. So often what parents tend to do is first, they won't give alternatives. They'll tell, do this, don't do that. Children are not happy with it. They are not open to it. Okay, if alternative is to be given, the parents can give alternatives in a judgmental way, in a biased way. Let's not try to do that. Let's be open while providing alternatives. When the children are small, this is easier. For example, a parent can ask the child whether you want half a glass of milk or full glass of milk. Now, as parents, I know everybody of you might say, of course, the child will ask for half a glass of milk. Fine. Start with a bigger glass and respect the child's wish of taking milk in that half glass. Similarly, as the child grows up, give him options. Just that while I am giving my child some options, I need to lay a base or I need to give a perspective about decision making. I will respect your choice. I just want you to learn healthy decision making, and just remember that every choice has a price. Now, what happens is, although parents warn children about these, and yet children make impulsive choices, what the mistake which happens on parents' part is they don't let the child pay the price or maybe live the consequence of his unhealthy choice. Children will be impulsive. They might go with the unhealthy choice. And when the time comes that the children take ownership of their choice and live what they have earned for themselves, then parents feel sorry for them. They feel that it's not correct to let the child be punished for his immature decision. But my point here is, unless and until my child takes the ownership of the price of his choice, how will he learn a wiser decision making? So point number one is offer alternatives, talk with them while they express. Let's listen to them non-judgmentally. This is the most difficult part because we are not able to relate with their choices. Be it the series they watch on Netflix or maybe the friends they have, the company they keep. Parents are many a times not happy about their choices. Yet, if we really want our children to open up to us and talk with us, we need to be very, very non-judgmental about their choices. See, it's all about developmental stage. I'm sure all of us, when we were kids, we had many, many things, a habit of collecting many, many things. Some of us collected marbles, some of us collected stamps, seashells, and whatnot. And then someday my mother went on a cleaning spree and she threw all the things that I had collected over years. Please note, for her, it was trash. But for me, it was a treasure. And how sad I felt when my mom just picked up and threw that treasure away. So according to their age and stage, they will find some things attractive, some things correct, some things good for them. Unless until I'm non-judgmental about these things, I won't be able to invite my child to talk with me, sit with me and talk with me across the table. So this is what I mean by when I say that we need to learn the language of Windows 10. I be non-judgmental. I be accepting at least till it is on the level of hearing them out. And the third important part is, of course, letting them face the consequences of their decisions. So I agree, when it comes to biological danger, we are not going to let them pay the price. But 99% of the issues are not of direct biological threat. And the earlier we start this, the better for me as well as my child. Is this okay, sir?
Fine.
Okay. Any other question? Shall we move ahead, Amrit sir?
Yes, please.
I think so, yeah.
Okay. So now let's have a session and see how the interaction goes between a mental health professional, a psychiatrist, or a psychologist, and a parent who has an adolescent with behavior issues. So any volunteers who could play the role of a parent? Yes, ma'am, Manisha.
Yes, good evening, madam.
Good evening. So Manisha, you'll be playing the role of a parent, right?
Yes.
And
I'll be speaking in Hindi and English. I'll try and speak in English, but I'm comfortable with Hindi, so I hope, because when it comes to emotional things, I think my native language becomes better. So I hope it is
sure,
okay.
but just try to keep it in English as much as possible.
I will try. Yeah, thank you.
Can you just give me a background of what case you're going to present? What would be the age of the child here?
I would present the case of a child of my son who is in first year of engineering, and he is basically addicted to mobile phones. He's not studying properly, and basically the consequences of getting addicted to mobile primarily. And I am just worried about his future.
Okay.
That will be the case that I'll be presenting.
Sure. And the name of the child here in this case?
I can say Nikhil.
Nikhil. Okay.
Yeah.
So Tofanpati sir, with your kind permission, can we start?
Yes, please.
Okay, thank you, sir. So Manisha ji, what we'll do is, let's not keep it a first session because the first session generally goes into history taking.
Yes.
So we'll I'm saying it aloud that this would be our second session. I know the history of your child. I have taken the history and I had advised for therapy sessions for your child as well as his parents.
Yes.
And probably you're coming to me for the second time today.
Yeah. Am I audible, ma'am?
Yes, you're clear.
Okay. Yeah.
Okay. Right. So let's begin the session now.
Okay.
Manisha ji, well, namaste.
Ji, namaste, madam.
Yes.
Madam, you had told me to get my son he was supposed to come for this session, but he's just not ready to come. He is just not ready to come. तो मैं पूछने आई हूँ मैं क्या करूँ, मैं परेशान हो गई इस बच्चे से. अब when I told him कि हाँ वो काउंसलर मैडम है, वो आपको हेल्प करेंगी, she'll help you get out of it. So he says, I don't have any problems. Why do you want me to go to the counselor? You told me once I went and now I don't want to go there anymore. तो मुझे समझ में नहीं आ रहा है मैं क्या करूँ. I mean, I'm really very, very fed up of this and I'm worried.
I can see your concern, Manisha ji, because it's your adolescent and with all the issues, you really want him to take help at this point. I can, of course, see that. But let's say, let's consider the next month. And if in this month, he is not at all willing to come here. However hard you try to force him or motivate him to come to me, let us consider the worst outcome that Nikhil is not willing to come and see a psychiatrist, a psychologist, anybody. Can you think about the things now? What do you and me actually have in our hands right now if he is not willing to come?
Madam, how can he get cured if he doesn't come to you? I mean, I was told when I first considered consulting you, I was told कि उसको काउंसलर के पास में ले जाओ, साइकेट्रिस्ट के पास में ले जाओ, वो उसे अच्छा कर देंगे. तो मेरे हाथ में तो कुछ नहीं है ना मैडम, जो करना है वो आप ही ने करना है, उसे तो आना ही पड़ेगा यहाँ पर. उसके बिना कैसे होगा आप बताइए. मैं क्या कर सकती हूँ? I cannot do anything. I'm helpless.
Okay. I can see the amount of worry that you are carrying right now. But let me just ask you a simple question. In a 24-hour span, I know Nikhil doesn't talk to you much. He doesn't spend too much of time with you. But let's say, how much time do you actually spend with your son in a day in terms of minutes or maybe hours?
Earlier it was very good, madam. But nowadays he hardly speaks. पर फिर भी say 15-20 minutes in a day. बस उससे ज़्यादा तो निखिल बात करता ही नहीं.
Fine. So even let's consider that he speaks to you. He is in front of you for 20 minutes in a day. And for rest of the day, although you are not directly communicating, you are in his direct environment. Is this true?
Yes.
Now,
yes, I am.
Let's say Nikhil comes and visits me. That would be 45 minutes in 15 days. Okay. Don't you think, Manisha ji, that you are in a better position to help him mold himself because of the quantum of time that you are in his presence?
But he just does not. कभी भी उससे कुछ बात करने लगो तो he gets very aggressive. तुम्हें नहीं समझता. You people don't listen to me. Leave me alone. I'd just like to go to my room. बस मुझे परेशान मत करो. अब इसमें मैं कोशिश करूं भी तो कैसे करूं? बचपन से उसे अपने साथ में ही किया है. बहुत स्मार्ट लड़का है, अच्छा लड़का है. बुरा लगता है पर मैं कुछ कर नहीं पा रही मैडम. अगर आप बोलेंगे भी कि I should sit with him and all, he is just not ready to talk to me.
Okay, so Manisha ji, what I see here is that you are telling me about the problems and I am trying to tell you about the solutions. At one time, we can either talk about the problem or the solution. What do you want to focus on?
ये तो solution ही चाहिए मैम, but आप ही के पास में है वो. You can only do something about it.
But let's at least agree on one thing, that for the next 20 minutes, instead of talking about what's not right, what's going wrong, what's not working, let us shift our focus on what is there in our hands and what we can do to help Nikhil realize himself better as a human being.
Okay. Yeah, we'll try. Okay.
Are we on the same page here?
Yes, we are.
So please note, I understand this is difficult for you. You love him very much. You have tried your best. But till now, have we worked as a team, you and me? No. Are you willing to give it a try?
Yes. उसके लिए कुछ भी करूंगी मैडम. मैं अभी तक करती आई हूँ, कुछ भी करूंगी.
चलिए एक पैर पे खड़े होके काम करते हैं फिर. Jokes apart, I know how much every mother loves her son. I too have a child. I know that. Okay. But the point is, we need to shift our focus. Otherwise, we'll be stuck in digging the problems deeper.
Okay. Fine.
Okay. So
I
now,
listen.
Just now you gave an example that he just doesn't listen to me. Whenever he's there in front of me, he just says, you don't understand and you'll never understand. And there's no point talking to you. Can you give me an example last when this had happened where he started something and it did not go in a healthy direction?
Every time it happens. Whenever I tell him, beta thoda padhai ki taraf dhyan do, he is scoring very low marks, madam. That is my main concern. तो कि थोड़ा पढ़ाई की तरफ ध्यान दो, अपना टाइम मैनेजमेंट करो, मोबाइल के ऊपर कम ध्यान दो. He just doesn't listen. You leave it to me, I'll do it. पर दिख रहा है ना मैडम, रिजल्ट तो नहीं आ रहा है ना.
Now you just told me an incident where you were talking to him and he was not listening. I'll ask you differently. Manisha ji, tell me the incident where he was talking to you. Go into the past, few months back, maybe few years back, when he was talking to you and probably you were not in a listening mode.
मैडम अब घर के काम रहते हैं, बिजी तो रहते ही हैं मदर लोग. तो अगर वो कभी कुछ आया होगा बताने के लिए कुछ, तो मैंने उसको उस समय बेटा थोड़ी देर में सुनती हूँ करके आई वुड जस्ट गो ऑफ एंड डू सम वर्क. अब ये तो बहुत कॉमन चीज है ना मैडम, ये तो होता ही है मदर्स की लाइफ में. अब फादर को उसके बिल्कुल टाइम नहीं होता है बात करने. जी.
See, please note, I'm not blaming you for anything.
No,
I'm just trying to understand how the dynamics work. So maybe it has happened that when he wanted to talk to you, either you were really, really occupied into something. At that time, your priority was such that, just ignoring it was not completely in your hands and you gave it your priority. Has it ever happened that Nikhil was very angry and he was blurting something in front of you, blaming some XYZ guy, and instead of listening him out, you were in a hurry to give him advice that don't talk in such a language, what kind of foul words are you using? Has this kind of a communication occurred?
हुआ तो था मैम एक बार. he was mentioning about his professor या उनके स्कूल के टीचर कुछ, कि उसने मुझे गलत मार्क्स दिया वगैरह. तो मैंने उसको बोला, मैंने कहा तूने पढ़ाई नहीं की होगी, टीचर क्यों ऐसा करेंगे. तो अपनी पढ़ाई की तरफ ध्यान दे तो आगे से ऐसी बारी नहीं आएगी. That is what I told him that time. Yeah.
Okay. See, again, we are not categorizing anything into right or wrong here. We are just looking at this in a neutral way.
Okay. Yeah.
Now, just try to visualize this scene in front of a TV in front of your eyes. Okay. So a child has come home from college and he is really agitated and irritated. Okay. Why to see it on a TV? Let me say that you place yourself in the position of a girl who is just back from college, who is really, really angry and agitated. Something really bad has happened with her. Okay. So are you able to put yourself in this girl's shoes?
I try, ma'am. Yes, I'll try. Yeah.
So you are really irritated because maybe your teacher has humiliated you in front of the entire class when it was not your fault. Okay. So you come home and you throw your sack on the sofa. I'm your mother. And you say, I'm irritated. I don't want to go and attend that stupid college. You just say it. Now, I will play two kinds of mothers in front of you. The first mother will say, what is this? Is this kind of a behavior? What is this, Manisha? First, pick up your bag. There are books in that. How come you're throwing your bag? Is this what we have taught you? And don't utter such words about your teachers. I'm sure it's you who has not studied and then creating such a scene. How are you feeling, Manisha?
Probably more irritated कि समझ नहीं रहे मेरे को. शायद ऐसा लगेगा मुझे कि अरे मैं कुछ कह रही हूँ उसे पहले सुन तो लो. Just listen to what I'm saying.
Please listen.
Yeah.
Okay. Now let me play the second mother. And I'll just say, okay, Manisha, I can see that you're really, really upset. Do you feel like talking to me? Okay. Now see, Manisha can say, yes, that teacher, I don't know what she thinks of herself, blah, blah, blah. Either you blurt out everything and you feel relieved, or you just storm into your room and say, no, I don't want to talk to anybody right now. In either of this case, one thing is for sure, that in your head, you know that your mother is there available for you. If you just start talking to me, I will listen everything that you say. I won't interrupt till you feel a bit of it has been emptied out. So I'll allow the catharsis, and then maybe once you feel better, then I can talk about that, yes, this was really not fair what happened to you today. But Manisha, tell me, is labeling the teachers going to help us in any way? So let's think about what you can do next whenever you are ready. Let's say if you storm out in your room and you don't open the door for half an hour, I have a choice to give you that privacy to cool down a bit, to settle down a bit. Then I can just go near the door and say that, beta, whenever you are comfortable, if you're hungry, let me know. I won't touch the topic. I won't show that I'm very desperate to help you right now. Because being an adolescent, there is this need for privacy and independence that is growing in you. So while respecting that, I will cater to rest of your needs. Let me know if you're hungry. Probably the child is already hungry. She'll say, yes, give me something. And maybe once you are better, after half an hour, after having something, you will be in a better mood to discuss things with me. So Manisha ji, can we just think of this as a strategy? That if I really want my child to communicate with me, I will have to give that platform to my child where he or she can open up without the fear of being judged or labeled or advised.
कोशिश कर सकते हैं मैम, we can try, but अभी थोड़ा मुश्किल लगता है कि since he's मैं उसे how do I tell him कि अच्छा तू बैठ, मैं तेरा सुनने के लिए तैयार हूँ. I don't think he is on that stage anymore. I think he's crossed that. और ऐसा नहीं है कि I did not listen to him, but yeah, कभी-कभी हो जाता है. I mean, it's very normal for a parent to be busy and not pay attention to what the child is saying.
Of course.
So you tell me how to do this.
Yes. So maybe let's not push ourselves too much into it so that he senses something is going wrong with my mother and she's too much interested
exactly.
in
Yeah, he'll say, अचानक माँ को क्या हो गया? इतनी कैसे सुधर गई?
Exactly. So let it not appear artificial.
Okay.
Just when he comes back from the college, or when you are spending those 15-20 minutes, maybe when he's having coffee or tea in the morning, or he's having dinner with you, just be open to listen to him. What is the proportion right now? How much do you speak and how much does Nikhil speak?
थोड़ा मेरा था, वो भी बात करता था, but now it is just the moment we start, it just goes in a wrong way, and probably he will speak a few sentences. I'll try and tell him जब कभी mood ठीक रहता है, so I tell him a few things. तो उस समय शायद मेरा proportion ज़्यादा रहता होगा.
Okay. So can we just take a couple of rules here? For example, that whenever he is talking, you will control your urge to interfere.
Okay. Oh, yes, I do that. I do that a couple of times. Yes.
I have an interesting acronym for you, which I have many a times used for myself. In my house now, I have written this word at a number of places. The word is wait. W-A-I-T, wait. Now this word doesn't just signify weight as in physical weight. It has a full form. W-A-I-T stands for why am I talking? Just as a reminder. Okay. So point number one that you can use is that you talk minimally and listen more openly. Sounds doable?
कोशिश करूंगी क्योंकि कई बार वो ऐसे subjects रहते हैं that you want to give your opinion. I mean, there are certain things which you feel they are not right, so the child needs to be controlled then and there. ऐसा मुझे लगता है बात करते समय कि नहीं, ये चीज जो तुम कह रहे हो वो ठीक नहीं है.
Agreed. But Manisha ji, just a quick question. Even though you advise him, what is the chance that he would follow your advice right now?
अभी तो नहीं है बिल्कुल.
So
he'll just say कि माँ you don't understand. Again, he'll just say that you don't understand, ma.
Right.
That's all.
So even for our advice to reach him better, don't we think that you need to go into his good books before that? For him to take
Yes.
your advice in a better way?
Yes, yes.
Okay.
Yeah, miss.
So we are talking about changing our way. See, you have gone directly and you have seen how much does he listen? Very, very little. Now I'm telling you, let's try this way. Are you willing to try it for a week before jumping onto the consequences?
Right, ma'am. Ma'am, but I have a question. I mean, I'm sorry, I'm going back. I mean, why should it happen? Because see, he has been my only child, brought up in a very nice way. We gave him like whatever, according to his age, whatever he needed. We have provided him everything. तो हमें तो लग रहा था हमने उसे बहुत लाड प्यार से बड़ा किया है. So why should this happen to him? I mean, he was a bright student. Now he doesn't study. So it really hurts me, and those questions keep bothering my mind a lot.
I'll try to answer according to the best of my abilities. Before that, Manisha ji, I want to just conclude this part of communication. Point number 1 is you are going to listen more, talk less. Point number 2, you are going to show interest in his areas of interest. See, children of this age might talk about football, league matches. They might talk about the series they watch on Netflix. Can you just be open and show interest in what is it instead of saying, Game of Thrones? Can you say, what is it about? How does the story progress? Can you just be open to his areas of interest?
कोशिश करूंगी मैम, क्योंकि वाकई मुझे नहीं समझ में आते हो. बट
फाइन, हम बस दूसरा पाथवे देख रहे हैं, हम राइट रॉन्ग में नहीं जा रहे हैं आज.
हाँ, ठीक है. या,
ठीक है.
यस यस.
आज का हमारा इतना ही गोल है that you and Nikhil bond well. Fine, sounds good?
Yeah, yes, I'll try. I'll definitely try.
Okay, so this is the second thing. Right. And third thing is, for this 1 week, you will avoid the topics which you continuously advise on, for example, studies. Just for a week. So listen more, talk less.
Talk less. Avoid talking to him about studies.
Avoid talking to him about studies
and get interested in what he wants to, in his world, basically, what he's.
Just try to understand him as a human being, rather than continuously looking at him as my son, he should be this way, my son, he should be this way. Yeah. Are you going to give your 100% in this?
I'll definitely try, ma'am. I'll definitely try.
Okay.
Yeah.
So before we move ahead, Manisha ji, I'll just answer your question wherein you asked as to why is this happening in spite of getting everything good.
I never imagined. Yeah. He was a very good child earlier.
Very intelligent. Yes. See, probably I can explain this to you with a story or a metaphor. That in spite of having everything, why do today's children, they get stuck in this mobile and things that are not helping them progress optimally? So there were 2 neighbors, and in their backyards, they had grown a lot of plants. The first neighbor had the habit of providing everything to his plants because he loved his plants. He loved his garden. So ample amount of water, fertilizers, pesticides. He used to give everything that the plants needed. Of course, as a result, the plants were growing beautifully, lush green, very, very healthy, and beautiful. The second man, on the other hand, used to provide only that much amount which was necessary for their survival. So he used to water his plants in a miserly way. Just that much amount of water which will allow the plant to survive, not more. Fertilizers or pesticides only and only if required, if the plant is withering, not otherwise. As a result, although all his plants were alive and well, they did not appear as healthy and as bushy as the first person's. One day what happened? A big storm came. There was thunder, lightning, tremendous amount of rain. and a big storm. Throughout the night, it was raining, and after this, the next morning, when these two people opened their doors and looked at their backyards, what they saw was the first man who had provided amply to his plants. The plants, although looked very, very healthy, they were actually not alive. Most of them were uprooted, lying dead in the backyard. On the other hand, the second person's plants, although they received everything in meager amounts, they were standing tall and erect. Hardly any of them was uprooted and was lying dead on the ground. You must be wondering why. The man too wondered as to why this happened. My plants were way healthier than this man's plants. Then how did this happen? So he asked the other person that how come your plants are alive and mine are all uprooted? To which the neighbor gave a very, very interesting answer. See, because you oversupplied your plants with everything, their roots got everything they needed in the superficial layer. They did not feel the need to go deep down in the soil in search for nutrients or water. On the other hand, because I gave very little to my plants, they had the internal urge to go and search for things. As a result, your plant's roots were quite superficial, so they got uprooted. And my plants, although they did not look very healthy, internally they were very, very sturdy because they had their roots deep in the ground. A quick question to you. When did you first think that I'll study well, I'll get a good job for myself? When did this happen?
I went to college, maybe.
Mm-hmm.
And I decided that, yeah, I should earn. And I was working actually before Nikhil was born.
Mm-hmm.
So,
but what, pushed you into this wish of studying, getting a good job?
in our times, actually, everybody knew that they have to do well in their life if they have to live a comfortable life. So all of my friends would go in that direction, and they would make their good careers and progress. So that was a general way of living at that time, that all of us would work hard and try to get some job. In fact, one of my friends said that, oh, if you're 21 and you are still on your parents' money, then there's something wrong with you. That was the kind of mindset I was brought up with.
That was mindset. Any incident you remember wherein something was missing in your life and you couldn't get it because you were dependent on your parents?
Oh, yeah. No, probably a scooter. I wanted to drive a scooter, and my mother said that, look, we can afford only, there used to be a Luna or some kind of vehicle at that time, which was lower than the scooter. So she says, now, she just मजाक में बोला उसने कि वो तू जब अपने पैसे कमाएगी तब ले लेना. I mean, these are small issues. I mean, I cannot say that prompted me to work hard, but yes, there were these kind of small happinesses in life which we thought that we can spend our own money and we can get those things when we start earning ourselves.
Manisha ji, I can see the difference even in your face and expressions right now when you think about that.
Yeah, it was really, and I still, that was my prized possession.
Yeah, so nice, so nice. And as a proud daughter, you must have also felt good for your parents, I'm sure.
Yes, I did.
Now, if you just keep yourself in the position of Nikhil, who has everything in abundance, rather he gets things even before he asks them. See, what is he yearning for?
But ma'am, as parents, how can we deprive them? I mean, उनके peers रहते हैं, वो उसके पास में, उसके पास ये, तो ऐसे कैसे कह दे कि नहीं तुमको हम नहीं दे सकते? He knows that his parents are earning well, they are well off. I mean, there has to be a reason. How can we say कि नहीं तुमको अभी उसकी जरूरत नहीं है? Beyond a point, you cannot say that. बच्चे थे तब तो ठीक था, लेकिन.
See, all of us have the tendency to think into black and white. So either I overprovide my child or I deprive him of anything. Did we ever use the word deprivation? just look at it from a third person's point of view. Because when it comes to Nikhil, you are emotionally too bonded to think in a neutral way. But tell me, is the only thing possible here for a parent is to over provide the child and absolutely deprive the child? Are these the only two options we are talking about?
No, there should be a
So
third
see,
way.
there is a difference between thinking in extremes, which is not helpful. Either way is not helpful.
Yes.
And thinking in a really, really healthy way, that I provide my child enough so that he tastes what a comfortable life looks like, but he doesn't start taking everything for granted so that the inner fire dies.
पहचानना तो पेरेंट के लिए थोड़ा मुश्किल है मैम, क्योंकि we as parents we feel that नहीं, इसकी एज में सबके पास में है तो इसके पास में भी होना चाहिए. That is a general.
That is a wish. I agree. What is important to you? Your wish or Nikhil's future?
Yeah, Nikhil's future. Yes, of course.
And you'll have to choose how much importance you give to a wish of yours and what are you ready to lose in turn of it.
नहीं, पर ऐसा भी हो सकता है कि उससे वो और नाराज हो जाएगा कि my parents they have everything, still they are not providing me with things that my friends have. तो वो नेगेटिव एक उसमें भी ना चला जाए वो बच्चा, वो शायद हमारी बात नहीं समझेगा कि हम उसके भले के लिए कर रहे हैं.
That's why we are here, so that it doesn't go in a way which is destructive.
Yeah.
So have you ever dealt with a kite, flown a kite?
हाँ, देखा है बचपन में उड़ाते हुए.
Tomorrow, I guess. Huh?
Yeah. So yes, tomorrow.
Do you realize that for a kite to gain good heights, at times we have to pull it very, very tightly.
Yes.
But when we
yes,
pull
sir.
it too tight,
we
also need to see how it's managing, and also we need to put it loose. Give it space to hover. Now, if you have blown a kite, you will realize, Manisha ji, that it's a balance between pulling tight and giving it some space or setting it loose. You keep on pulling tight, it will break. You just set it all loose and it will wander away. It will never come back to you. So it is a balance between pulling tight and setting loose. We need to go in this process together, but I need you to understand all the principles, accept them before you leave this room today. Because if you are doubtful, it will again reflect onto your behavior. And secondly, very, very importantly, I don't want you to go and get fixed into the trap of parental guilt. Parental guilt.
Guilt. Okay. नहीं, वो तो रहता है मैं.
Does it help you in any way?
Yeah, it doesn't. Maybe it doesn't, but लगता तो है ना बच्चे के लिए कि हमने इतना किया, या शायद मेरी ही गलती है, मेरी परवरिश में कुछ कमी रह गई कि अभी he is behaving like this. That is very.
Let us accept our emotions as the emotions of a parent. Let us respect those emotions. But let us not get drowned in them because we want to do something for our kid.
Okay.
Right now, it will be a walk on a tightrope for you when you will be dealing all these things with Nikhil.
Okay.
And you will be able to walk that rope only and only if you are balanced from within.
Okay.
We are going
I'll try, ma'am. I'll try, definitely.
So we are going to take small steps.
Okay.
Today we have talked about 3 principles of communication.
Yes.
We'll apply it for a week and see what happens. If things go wrong, I'm here to talk it out with you and we can change our course once again.
Fine.
Okay?
Yes.
I'll just end this conversation, Manisha ji, with a small question for you. Okay?
So that
tells you the importance of this journey that you are going to start new. Let's say you have pain in your abdomen, very sharp pain. unbearable pain, and you rush to your general practitioner, your family doctor. He examines you and says, Manisha, this is appendix, appendix pain, and you need to get operated and remove this appendix immediately. So you say, okay, doctor, suggest me whom should I visit? Let me get it done. So he gives you a name. He writes down a name. You visit that surgeon. Now the surgeon examines you and says, yes, Manisha ji, you have an inflamed appendix. We'll remove it. So let's plan the surgery after 6 hours. You don't eat anything and we'll get it removed. You know what? I love all my patients, but you know what? I haven't performed an appendectomy before this. I haven't. But you know what? I love my patients very much. I won't let anything happen to them. What would you do? Will you get admitted?
I don't think so. I mean, I have to be confident in the person. I mean, he has to be experienced, the person.
But he's saying he loves you. As a patient, he loves you.
That's okay. But still, I mean, I'm putting my life in his hand. So that experience counts.
What we're trying to see is love is not enough.
Okay.
Skills are required. So as Nikhil's mother, you love him tremendously. You love him enormously. That is not the question. The question is, are you willing to gather skills which will help you to help him better till the time comes that he approaches us?
Okay. I get it. Yeah.
So love, emotions, guilt, everything accepted. Skills are more important. And here we will be talking only about working and improving on your skills.
My skills.
Yes.
Before, okay.
Before
as
working on his skills.
Okay, fine.
Are you 100% convinced now?
No, now I get where we are going to. Yes, I think, yeah, I'm more comfortable now.
All right.
I think I should be able to contribute. But definitely I'll need your guidance and you have to guide me through this journey.
Of course, we are in this partnership now. And let's start one small step at a time.
Thank you, ma'am. Thank you so much.
So see you next week. And just follow the 3 rules we have talked about. And let's go slow and peacefully.
Okay, fine. Yeah. Thank you so much.
See you next
Thank
week.
you.
Yeah, take care. Okay.
Thank you so much, Manisha ji. Sukada, it was very entertaining also, knowledgeable. so I'm saving my appendix here.
Good one, sir.
I think we should, Tufan sir, should we take questions now?
We can take some questions from the chat.
Because already 9:15 is there. So before taking questions, how did we proceed in the interview? What did you actually do in the interview? A brief summary about that.
Sure, sir. So initially we started with the principles of developmental gradient of a child and communication. So that part I did not repeat in the session because we had already talked about the principles. Next, we first tried to pacify the mother in terms of her emotions when she was very, very anxious and worried as to the life of her son. And once we did that, we mirrored her emotions, we empathized with her, telling her that I can understand your concern, I too am in the same boat, just trying to normalize her situation. So we tend to pathologize situations when it comes to our emotions and our near and dear ones. And normalizing helps in this case. That was point number 1. Point number 2 was understanding her point of view as to what is wrong. Here, the mother was constantly talking about the son. Then the second important step that I tried to do was shift her focus from her son to her. She was again not very much willing, because she kept on saying that, what is in my hands and he doesn't talk to me. So that often becomes a task while dealing with parents that, we can't do anything and you cure our child as if by magic. So again, we need to spend a couple of minutes there very, very patiently trying to tell them and empower them that they are the best people who, if have proper skills, can navigate their child better. Then I think as the session progressed and she talked about things, this was the classic REBT approach that I used here, that focusing on to the factors within control rather than focusing on A or the trigger which is leading to all these disturbances, and how I can take ownership of my contribution in the process and how I can change. As you must have seen, I used a lot of metaphors and examples so that the client understands the principles better. Otherwise, what happens is the change is very, very superficial. The client says, okay, I've understood everything, but finds it very, very difficult to apply it when actually the crisis situation comes. So with all these examples and stuff, we gradually brought into her contribution in the development and well-being of her child. Again, we touched a couple of things like answering her questions. So although the question was very, very abrupt, I tried to conclude it, bring it to some meaningful full stop there, and then answered the question as to why this happens. Because again, this haunts the parents, that in spite of giving everything, why my son does like that. And lastly, I just summed up by repeating what she's going to try. And again, the crux behind all this, that we are not doing this to cure her son or something like that, but it's a journey together and it's a partnership together, and we have to go the way by dealing with ourselves first and later on with the person whom we love the most, that is our child. So in a nutshell.
Thank you so much. So she went for the treatment of her son, and now she is under the therapy.
Yes.
Yeah, let me invite the chairperson, Savita ma'am and Dr. Nidhi, for your comments, please. Then we'll take some questions from the chat box.
Okay, well, Sukhada, this was very informative. You focused on the one very, very major issue in child development and the care of children and adolescents, that is parenting. Parenting is a very important and significant task, which all of us just take it for sort of granted and do it by intuition or by what we have seen or what we have learned, handed down to us from our elders, and in the cultural patterns, we tend to just focus on that and not do it more than scientifically. I think more systematically and with great amount of understanding the principle and the meaning behind our actions, our own actions and behavior that has impact on the children. And today's your presentation primarily was focused only on parenting and parental aspects. I thought initially that you would be talking about the child, the adolescent, how they have to be handled and how to build resilience in them. But maybe that is for, you said, another session. And parenting, again, I think becomes when we are realizing and gradually learning and recognizing it to be one of the very, very important and significant skill, tool, knowledge, learning that we must all have, and for which we do not have as yet any systematic kind of learning platforms. And various principles that you highlighted, they were very important. And other thing which I would say is that you try to make more an emotive contact with the patient rather than informative. It's not simply kind of giving information, do this, don't do this, like a kind of a prescriptive approach. It was not a prescriptive approach. It was more like a participatory and an emotive approach, where the person had to empathically understand the value or the message that was being conveyed. And then hopefully, let's see, I mean, the parent, the mother is able to kind of employ some of these and bring about a change in her own behavior. So this is what I will say. Maybe Nidhi may have something to say here.
Yeah, I would say a beautiful session with illustrative examples and specifically in layman language, like with which even a common man can relate to. And the things that you've highlighted is, as Savita ma'am has said, is basically the parenting principles, and which the parents also need to understand that suddenly the way they handle or parent their 7 or 8-year-old child is not the same way as they can handle their 14 or 15-year-old. Even their parenting needs to change, and even their strategies need to change, because the child is growing and is into a developmental phase now. And that's very important, as you highlighted, that the individual or the adolescents also need some freedom, some space, some privacy of his or her own self. And they actually dislike the intrusiveness of the parents every now and then. So that's very important. That should be given as a fact to parents, that even they need their privacy and their freedom. So let them have it. There's absolutely not a problem. But parental supervision and control is very important, and that should continue as an umbrella above the adolescent. Another important thing is that, which you highlighted in your session, is that it's very important to listen to the adolescent. Sit and listen rather than always lecturing the adolescent. Sit and listen and be open to opinion of the adolescent also. It's not always that the adolescent would be wrong. They might be right in their perspective. Maybe it needs some discussion. Maybe it may lead to some negotiations and some solutions thereafter. So it's very important to listen to the adolescent also. So these are very important things that have been highlighted. And I hope there are future practical sessions continuing with the one today, because this was probably just an initial session with the parent. There is much more to do with the parent and the adolescent himself or herself, for some changes to occur actually in the adolescent and in the family atmosphere per se. Thank you.
There are a few raised hands. Are they still there?
There are many questions in the chat box, Amrit.
Yeah, you start.
Yeah, Sukada, please tell me, you said avoid talking to the child about studies. Okay, so till how long? His exam is next month. His board exam is next month. So what do I do now? Do I let him fail?
Sir, had this parent come to me before board exams, then this would not have been the flow of the session. Then our goal would have totally been how to help your child focus on your exam preparation right now. So this we consider that in the normal span of the year, the parent has come, and that too, I have given her this task only for 1 week. So there is a very beautiful story given by Vinoba Bhave, the freedom fighter. He has compared all of our minds with a house. So he says that all the good qualities in a person are like a door, and all the negative qualities in that person are like the wall. Now, if I want to enter somebody's house, will I enter through the door or through the wall? Of course, through the door. So if I have to enter any person's inner circle or trust circle, I'll have to enter through the doors, and doors are good qualities. So here, if the parent continuously talks about the thing that the child is weak in or is lagging in, it will be like hitting my head on the wall, and it won't help. So first I have to enter that person's house, establish trust rapport, and then I'll have to talk about the corrections or the changes. But this is a very common mistake that happens in communication, that we start with the walls, we bang our heads and then say, this person is not open to me. Why would that person be if we are just talking in a complaining way? So that was just for 1 week to help the mother establish a neutral communication with her son. Once she has entered, gained space into that child's world once again, these things are of course going to come, but that of course cannot be the start by which the mother has to rekindle the communication with her son. So just for a week.
Okay, and are we over providing our children? You said the amenities should be just enough.
Yeah, so sir, this is a very trick question, and every parent has to think for himself or herself. There is a very thin line between over providing and providing optimally. I very specifically use this term wherein you have to provide that much so that the child tastes what living a successful life looks like. But at the same time, you don't have to let the child drown in it so that he loses the importance of everything and starts taking everything for granted. So it's a very delicate balance, that how much we are providing and what are we holding back, so that the child develops that fire within them, that I too want to earn this kind of a lifestyle. So this is, I mean, very, very subjective for each parent, but something that every parent needs to think about.
Sure. And the child was having phone addiction. So any brief on that? There's a question in the chat box. Ma'am, at present time, most of the children have phone addiction. I want to know about the basic tips, how to deal with the phone addiction.
Okay.
There's a corollary question also, madam, to it. How to handle impulsivity in teenagers, especially due to increased screen time? I think we can take that question together.
Okay, so I'll just brief a couple of things about it, of course, because of the shortage of time. So first is the principles of managing screen addictions are the same as we go for any hard substance addiction. Point number one, which can be, of course, read in any book. Second is when we talk of something like screen addiction or mobile addiction in adolescents, most of the times it is not in the parents' hands to just remove that phone or take it away, confiscate the phone from the child. Then here, the choice price principle is something that the parents can start working with. Thirdly, the point wherein we talk about negative and positive reinforcement. Here, the only word of concern or caution is, today, if I just bluntly disallow my child from using the phone, today my children have access to many, many things, and they might go to the wrong way of earning their mobile back. So instead of being very, very rigid and thinking of things like confiscating altogether, I will have to use a very, very balanced approach of positive and negative reinforcement, so that the child understands what is ultimately important to him and then manages his screen time. Last and the fourth point is not a very positive point to hear, but again, the same thing that I discussed last time after having that case with that adolescent, is that parents need to know that some things will be totally beyond their control. And in such a scenario, you know, for example, there is a borderline personality, a girl with borderline personality coming to me, and she's having this mobile addiction. I had this case wherein the mother talked about reducing the screen time and mobile usage, and she changed the Wi-Fi password and blah, 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 and she did this thing. Within 2 days, the girl got an iPhone. The mother was clueless as to where she got that iPhone from. Now, of course, she might be having some friends from whom she got it. We don't know. But today, children have access to many things which parents don't even know. So there's no point in directly diving into this kind of what you call dushmani with them, so that they go on to other tracks. And therefore, when we talk about reinforcement, it differs from the reinforcement which we read in textbooks. So again, with adolescents, this has to be a very, very balanced approach. Somewhere, lastly, as I said, the parents need to know where to stop. So instead of, you know, they focusing on decreasing the mobile time of their kid, if they can think of or work on something positive that adds meaning to their child's life, something that gives perspective to the child's life better, then again the balance becomes better. So we need to shift our focus from, you know, making the child do something less to adding something which the child wants to do, so that this thing is balanced better.
Yeah, Shweta, in the chat box, want to ask, suppose someone sends the child to a boarding school because I cannot control them. I want to send them to the boarding school. What is your opinion?
Sir, this is a very vague question. I am nowhere in a position.
Sukda madam, I'll tell the full answer. She again asked the question. Looking forward to the guidance on how to deal with my 18-year-old girl who is short-tempered and rebellious, who wants to go out to do her graduation from a different city. We as parents are hesitant. Thank you in advance for your help. So she wants guidance on how to deal with her daughters. 2 to 3 times she's put this question.
Okay, so I'll just again answer in a couple of sentences. So the principle here is quite simple. One day my child is going to venture out into the world. If I stop my daughter from going today, maybe if not for graduation, for post-graduation, she is going to go out. Now, the only concern that parents generally have here, that while she goes for post-graduation, her maturity might be more. But there is also the other side to this coin, that if she goes out later, till then maybe her personality pattern, her temperament, her rigidity has also increased. So there are pros and cons to both these things. The LCM here, the bottom line here is very, very simple. Let my child go out of the house whenever he or she wants. My focus shouldn't be the age of the child when she ventures out. My focus should be my relation with my child when she ventures out, so that whenever she falls down, she has 100% trust to call me back home, that my parents won't put up a finger onto me. Pehle hi bola tha mat ja. She won't have to listen to this. Rather, she'll get support and guidance. So rather than the age at which my child goes out, it's the trust that my child has, that it's a journey of your life. You will have to go there at any point. If you fall down, if somebody puts a pistol on your head and say, give me your belongings, any difficulty, any crisis, we are a phone call away. So the learning journey of my child has to continue, and me, I should be in the role of a parent and a supporter, that I should be like a rock whenever and if she falls down. So that's again my personal opinion on this.
Thank you so much. Thank you.
Excellent.
Tufan sir, over to you. I think
over to me. I just appreciated the answer by yourself.
Yes, sir.
But then we have to end it, sir. It's 9:40, around 9:35.
9:30 is already, and there are too many requests for a separate session on phone addiction. Actually, so-called phone addiction. Actually, we wanted to do that, but today only the parent could be handled. So if we can request myself, Amrit and Tufan sir can request Sukhuda to come again, because we have not yet talked to the adolescent.
So maybe, sir, what we can do is then we won't do the practical part, because in a demonstration, it never goes as per what I want to say. It always will go according to what the participant wants. Then we can just talk about mobile addiction, screen addiction, and have it a theoretical perspective part.
And some case vignettes you can discuss, madam.
Of course, sir. Of course. But not live demos.
No. Alim is obsessed with live demos.
Yes, sir.
Tufan
sir, your comments, please.
Today's session has been very much interesting. As Arun Marwale, I think he commented that it was just like watching a movie. Thank you, Sukhuda, for a nice preparation. But one thing strikes me. We had been discussing about the parent who comes with a problematic adolescent to our clinic. And we guide that parent. But ideally, if we are thinking for the society, this guidance should reach all the parents. So this has to be part of massive awareness, which is the main solution, rather than waiting for a rich parent to come with the kid to our clinic. I think all the 200 odd psychiatrists over here, so then those who come, they are above average middle class people. Others are being ignored from the benefits of this discourse. And you must have that in mind, that we must reach out to the parents in general. That is most essential, and in such way that you have done today. And another thing, we can devise ways for, and Dr. Malhotra is there. She is an authority in child psychiatry in India. And she has also a lot of social perspective in her thinking. I have interacted with her a lot of times. And another thing, when I'm thinking of this phone addiction, nowadays you cannot take it away. A student can only read if he has a laptop or a phone. And this present situation has again shifted. All the examinations are being shifted. But if for studying you allow me to go look at the phone for 6 hours, why not for me another 2 hours? How to answer that? So the next session we talk about phone addiction. I think you have to take this part into consideration. You cannot just don't use phone for this. You just attend your classes and close down the laptop. It's not possible. And as you rightly told, our children are much ahead of us. Thank you very much for your deliberation. And it is very nice. It reminded me of one of Khalil Gibran's comments. Your children came through you, not from you. It's fantastic. Thank you.
Thank you. Thank you, sir.
Thank you, everyone.
Thank you, Sukhida madam.
And Amrit for vote of thanks, formal vote of thanks.
Vote of thanks. I'll just like to thank Sukhida for coming again and again. But then we want you again.
Pleasure, sir.
And 350 viewers today. It was a great show. Thank you, Nidhi madam, for coming and sharing. We are meeting for the first time. We'll be online. Savita madam, Jindabad. Kaise madam? Thank you so much for taking your time out.
Very nice to see everybody. Very nice.
We hope we'll meet this next weekend, but then it's postponed. We've been meeting quite a lot, even in the COVID times. Madam, all the best for your next week's results.
Oh, wow.
I'm reminding you again and again. Thank you.
Thank you. Thank
All
you.
our viewers. Thank you,
Thank you, sir.
Odisha State Bank. Thank you, Tufan sir. Alim, who is the energy of our whole webinar. Thank you, everybody. Good night. We had a wonderful session. Sukhda, we'll see you again in maybe 3 to 4 weeks.
Sure,
Get ready.
Sure,
You can't escape now.
Pleasure, sir. Thank you so much.
Good night.
Thank you. Thank you so much.